All right, welcome back, and thank you for staying with us here for Creme 2 News at 4:30. I'm Whitney Ward.
And I'm Tom Sherry. Well, it's definitely winter, which means it's time for dry skin. And we are joined now by Dr. Philip Werschler with the Spokane Dermatology Clinic. So, Doctor, thank you for joining us. And let's start with some of the most common skin problems that you see this time of year.
Well, and thank you, Tom and Whitney, for inviting me on today. It's a pleasure. Yes, with the cold and the drier weather comes skin problems. What typically happens is cold weather is not a friend of your skin. It dries out your skin. It causes eczema to itch more. People that ordinarily don't have dry skin oftentimes develop it in the winter, especially the seniors. And then what else can happen is we like to take these long, hot, and frequent showers in the wintertime to warm up, and that just dries out your skin some more. So we see a worsening of dry skin conditions that ordinarily maybe wouldn't even be present in the summertime in the warmer weather. We also see some skin conditions like psoriasis, which gets worse when you remove the sun from the equation. And this time of year, of course, as we know, not a lot of sun, and it's too cold to have your clothes off and being out in the sun. So absolutely, winter is not your skin's friend.
All right, so let's talk about a couple of things. You mentioned psoriasis or maybe rosacea. Those are things that might flare up this time of year that maybe you wouldn't ever experience. But even just regular dry skin on your hands that lotion just doesn't touch. It just doesn't help.
Cracks right on the knuckles.
Yeah, so it's so frustrating when you're lathering on the lotion and it's not helping. So how do you advise people to kind of treat that, and what can they do, and how can they identify some of those other skin conditions and watch out for those?
Sure, absolutely, Whitney. So first of all, year-round sunscreen is your best friend. Even in the wintertime, we can get those we sometimes call snow burns from the sun. And sunscreens that we might use in the summer, for example, that might be aerosolized and contain some alcohol can be drying. In the wintertime, we want to move over to more creams and ointments, things like that. Also hand creams. And those all act as preventatives from irritation, from developing rashing on the skin, or making existing rashing worse. And then if that occurs, then we move on to medications.
Okay, Dr. Werschler, let's ask this one. Can you tell us the kind of treatments that your clinic actually provides?
Absolutely. So in addition to the standard, write the prescription, go to the pharmacy, wait, pick it up, and hope that they have it in stock, we also, we dispense medications here in the office that come from an FDA registered, what is called a 503B outsourcing facility. Now that's kind of a mouthful, but what that means is that these FDA registered medications that we can dispense in the office. And actually today, a majority of dermatology offices nationwide now do this. And in particular, we use a brand that's called Prescriber's Choice. And these are all medicines which contain ingredients that we are actually able to customize. So, when you get a medication that is a standard prescription, you generally have a limited selection of what strength, what size a tube or bottle that it comes in. And what we provide is essentially customization for each individual patient. And this is something that is really newer. In the last few years, the FDA has allowed us a pathway to inventory, to stock, and dispense these medications. So now you come in, let's say that you have some dry weather eczema and your legs are itching. And we diagnose that. We tell you there's a medication that we have that's available that you can get right during your visit. And the cost on these medications is actually very reasonable. The cost factor actually tends to be about at the same price range or less than the copay that most insurance companies will charge you when you pick up your medications at the pharmacy. So this is something that's new and different. And what it does, it allows our patients to get the medication at the point of service. It allows them to get exactly what we want and not something that's substituted at the pharmacy dispensing level. And it allows the patients then to get better faster.
I imagine that this is also a good time to remind all patients, but even just everybody out there in the area, it's not just about our hands and our faces, right? Like, we need to remember, especially when it's dry like this, our whole bodies, all of our skin, right?
Absolutely. And again, it's a combination of the weather, and it's also our personal hygiene habits in the colder weather. Lots of my patients will come in and they'll say, I itch. And I'll say, well, how many showers a day do you take? Well, I usually take 2 in the wintertime because it feels good to warm up in the morning, and it feels good to warm up before I go to bed. And I'll say, you like long, hot showers, don't you? It's like, oh, yeah, absolutely. Sometimes my wife complains that I use all the hot water. I'll say, okay, here's what we need to do. We need to back off to 1 a day, or even sometimes bathing once every other day. Keep the showers shorter and cooler. Be careful on the use of deodorant soaps. They dry your skin out more. They're okay for the hands and the private parts, but you don't really need a deodorant soap over the whole body. When you get out of the shower, I want you to moisturize. And for women, that's a normal routine. For guys, they sometimes look at me like I just said something really odd or strange to them. Go, I don't moisturize. And I don't even have moisturizer. And then I say, I bet your wife does. And if not, let me give you some recommendations. And then for the rashy areas that they have, I'll give them a recommendation for a certain medication. I'll explain to them what the options are, that you can pick it up here at the office from this FDA registered, what we call this 503B. This is a new term. We have all these new, government terms, but 503B is the new term for a pathway, again, that allows the dermatologist and the office to dispense at the time of your visit, at the point of service. So you walk out not with a prescription, but you walk out with a prescription medication. And that makes it so much easier. And we have a huge list of medications that we can choose from. And if we don't have them, we can have them delivered to you generally in 24 to 48 hours through just as part of the program that Prescriber's Choice has. So it makes it convenient to the patients. It makes it cost conscious to the patients. Many times these prescription medications will have copays that are $100, $200. Sometimes I've seen $500 copays for a medication, and people just can't afford that. Most of these medications run right around the $50 price point, which is very, very close to the average copay that one pays at the pharmacy if they have the medicine. Plus, we get to make sure that the specific medications that we want our patients to have, that they get those, and that they're not substituted. Some up to 70% of medications are actually substituted at the dispensing level. So some of those substitutions, of course, are just fine. Some of those are not just fine. Imagine that I gave you a medication and I wanted it in a nice soothing ointment base because your skin is raw and irritated. And imagine you get the same medicine, but it's in an alcohol base, and you put it on and it burns and stings. Well, you won't use it. And then when you come in for your follow-up and I ask how you're doing, the response I get is, well, I'm not doing well at all. I'm worse. I tried that medicine that you gave me and it was burning and stinging my skin. I said, that's not the medicine I gave you. Well, here it is. I go, oh, yeah, they did a substitution. And again, sometimes substitutions are just fine, but sometimes they're not. Okay. So what we want to do is we want to put more control over things.
Well, I tell you what, great information today, and we certainly appreciate your time. Dr. Philip Werschler, thank you so much from the Spokane Dermatology Clinic. We appreciate all your help today, and we hope for nice moisturized skin now in the future.
Well, I'd love that. Thank you very much, doctor. And of course, the other thing to remember.
And thank you, Tom and Whitney. I appreciate it.
Have a good rest of your night, doctor.